My name is Monica Marasco, and today I will be talking about the clinical anatomy video presentation. Here are my notes. So, the system that I chose to focus more on was the skeletal system. I chose this system because I think it's really fascinating to learn about the different bones and the joints in your body. You hear all the time about how people break bones and whatnot, and I find it particularly interesting, even though it kind of broken bones and stuff freaks me out. I like the anatomy of the skeletal system. So, the name of the specialty that would diagnose or treat or whatnot isn't necessarily just on the bones. So, the one that I found that would probably be the most applicable to the skeletal system was rheumatology, because rheumatology can focus on joints, bones, what associates to that kind of pain, what they can do to help reduce pain, such as chronic back pain or like rheumatoid arthritis, stuff like that. So it's a very multifaceted system, but rheumatology kind of condenses it all into one clinical study. I also found that endocrinology could probably work too. For the study of bones and whatnot, we learned about a few hormones in the pituitary, um, in the thyroid that help with calcium levels and whatnot. So if you needed to go to an endocrinologist so that they could help regulate those levels or whatnot, you could. So that differs in orthopedic surgery, though. That is the surgical specialty. So if you were to break a bone, if you were needing a knee replacement, a hip replacement, or whatnot, you would go to an orthopedic surgeon who actually fixes the physical damage to the bone, the joint, ligaments, tendons, whatever. So I chose the bone to focus on. I have my little skeleton right here, was the femur. In the femur, directionally, it is proximal to the patella and the tibia and fibula and the bones of the foot. It is distal from the pelvic girdle. Um, Proximal could also be superior, and then distal could also be inferior. Um, I'm a little bit hesitant to say that it's medial from the radius and ulna, just because I don't know, like, anatomically if that would be correct, but maybe it will. So maybe medial and lateral could work too. The 5 anatomical landmarks I chose to look at were the head of the femur, which is right here, and then the neck of the femur right here, the greater trochanter, and then the lesser trochanter as well. If I turn him around, this right here is the intercondylar fossa. Those are landmarks to easily tell if this is the femur as opposed to the humerus. And just the function of the femur is to be a weight-bearing bone of the leg. It also allows for movement, walking and running and whatnot.